Hi everyone. Um, this is like my first time doing a live via YouTube. I'm just going to wait until when we have a little bit more number of people joining today. And I'm going to be talking about how you can start your journey as a pain nurse in the UK. Okay. Good morning. Good morning. Good morning. Hmm. Um, just in case, if you've got any questions, just let me know and I will try to answer to the best of my knowledge. Hmm. I'll just wait for a few more people and we can go on with the live. Hmm. Okay. It's 11:01. Just 1 minute past 11 because I said we're gonna start by 11. What would you want me to chat with you about? What do you want to know? Let's start from there. Okay, hi. Let me introduce myself properly. My name is Mercy and I'm a nurse. I'm currently practicing in the UK and I am practicing as a clinical nurse specialist in pain management, and that's a band 7. That's a band 7. So today I just want to share a little bit of my experience and how I started my journey as a pain nurse. If this is a specialty you have been considering, then this video is for you because I believe you will get some information that would enable you to kickstart this journey. So while I am just talking away, if you have got any questions, please leave it in the comment section and I will try as much as possible to answer. And if I do not have the right answer right away, I'll do a little bit of a research and I will get back to you. So I think we should fire away because it's 11:02 already. I don't want to take much of your time, so I think we'll just get into it. So, pain management nursing is a specialty I didn't know existed before because I'm a Nigerian and where I am coming from, there was no specialty of sort to the best of my knowledge, so I didn't know anything about it. And then I moved to the UK and I was working on the surgical floor. That was where I was working, and I had a patient who had just come back from the theater, and the patient had like her regular analgesia given, but she was still in so much pain. Like she was literally in so much pain. I was a band 5 then, so I had to go speak to my nurse in charge, and I had to like let her know what my concerns were. And when I did that, she was like, put a referrer to the pain nurse to come and see the patient. And I'm like, there is something called pain nurse. She was like, yeah, I should put a referrer to the pain nurse. So I did put the referrer to the pain nurse and she came, saw the patient, did her recommendations, and everything was just going smoothly like that. The patient's pain was controlled, and I got interested in the specialty from then. So afterwards, I went on and I spoke to this lady, because it was a lady that came to see the patient. I spoke to the lady and I was like, okay, I'm interested in your specialty, but I don't know what you do. What do you do? And we got talking, and something I did was I decided to shadow her on like some days, just see how her day usually goes, like on a normal basis. What do you do? So I will know what it is I'm getting myself interested in. And so I shadowed her, went on rounds with her, saw what it is that they do on a normal basis, and then I went on to do my own research as well. And I decided to say, okay, this is what I want to do, and this is how I want to, start this journey. And that was how I was interested in it. And I started the journey from there. What I then did was I went on to do some online courses, just something that would give me a little bit of an advantage, a little bit of an edge, just to so that when I'm applying for jobs, they can see it on my CV that, okay, I've done so and so and so professional development, and it's something that they would consider me with when I'm applying for jobs. And so I went on, did some courses, started applying for jobs, and I got one job. So basically that's how my journey has been so far, and that's how I started pain nursing as a specialty. So if you've got anything particular that you would want to ask, I would love you to ask it, so that way I can answer your questions and then we can take it up from there. I really don't know what to talk about. So I would love to have your questions and see what it is that you would want to know about particularly, because that way I can answer your questions for you. Any question? Okay, someone said, what is pain nursing like in the UK? Well, it is an interesting specialty. Honestly, it's very interesting because you do not work as a bedside nurse. So what you do on a day-to-day basis is you get into the office, like what I did when I got the job as a band 6. You get into the office, you have a look at your referrer. If you are an acute pain nurse or a chronic pain nurse, depending on what area of pain management you are in, or pain, or the pain service that you are on, you would have a look at your referrals. For acute pain nurses, for chronic pain nurses, you really do not do referrals per se, because you would have your bosses that would have to triage the referrals, and then you would have your own workload that you would review on that day. So as an acute pain nurse, you would have a look at your referrals, you would do like a mini handover between you and your other colleagues, and then there would be like a distribution of the workload, and you would have your own patients that you would see on that day. So usually when I get into the office, have a look at the referrals, like I've said, we do the handover, and then you have to review the documents of the patient, see the reason for the referral, see how the patient is responding to the current treatment plan. You go on to review the patient, and if you would want to suggest anything else, then that's when you would suggest it. If not, if you've got like any concerns or any queries, you have got like pain consultants, you've got senior nurses that you can speak to and just let them know, okay, this is this patient, this is the diagnosis of the patient, this is the current treatment plan the patient is on, the patient is still struggling in pain, and then this is what you are considering to recommend, what would your pain consultant or what would your senior nurse recommend as well? And then you guys can brainstorm together, and you can go off to see the patient, have a chat with the patient, see what's going on. Also ensure that you have a look at the allergies of the patient and what the patient have tried in the past. That way it gives you an idea of what it is that you're going to recommend to the patient, and you can always ensure that when you speak with the patient, the patient is always the best person to speak to, because they know what it is that they have tried, and then you know what it is that you can recommend. So with that, pain nursing in the UK is amazing. I will tell you, I really enjoy being a pain nurse, and it's something that gives me job satisfaction. So it has been an amazing adventure so far. Oh yes, after reviewing the patient, when you get back to the office, you have to do your documentation. Like they say, if you do not document, then it did not happen. So you need to document and have a look all through the day. Towards the end of the day, if you've got any more referrals, then you go on to see the patient. If not, then you can continue updating your details and every other thing that you would want updated for that day. Any other question? Oh, okay, no. Someone said, you said it's not bedside nursing. Do you do shifts at all? No, 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 no. There are no shifts. You work Monday to Friday, and it's either you do 8 to 4 or you do 9 to 5. So it's a 5-day kind of work. It's not like bedside nursing that you would work for 3 days and then you have some days off. No, it's like office job. So you work 5 days a week, and then is it flexible? Yes, it depends on where you are working. My previous trust, there was availability for flexibility. So I was working 4 days a week because I was working as an acute pain nurse. I was working 4 days a week, and I was working 8 a.m. to 6 p.m. That's the flexibility you get. And so you work 4 days a week, you have a day off in the week, and then you have your weekends off. But where I'm working at the moment, it is 5 days a week, 9 to 5. So that's the job I do, 9 to 5, and I have my weekends off. There are some job roles as a pain nurse that you probably would have to alternate the weekends depending on the trust, and depending on what it is that the trust offers. If they do 2-4-7, then you would probably have to alternate the weekends between you and your other colleagues, like how I was doing in my previous trust. Dennis Camus said, can I start as a caregiver and study nursing? That's a different question to today, but yes, depending on where you are coming from, yes, you can start as a caregiver if you get a job, and then you can go on to study nursing. And something, let me even give you this information. Something you can do is, there are some organizations, some trusts that can sponsor you to study nursing, but they probably will not send you straight up to study nursing that you will get a band 5 job role. What they probably would do is, they probably would send you to school to study like a nursing associate role, like a nurse associate role. That's a band 4 role. And then you probably would have like a bond, like a contract with them to say, okay, you would go to school on their terms, and you would have to give some years to them, work for them for a certain number of years before you leave them. If you leave them before the end of that contract, then you probably have to pay back some money that they paid you to go to school for. Because as a nurse associate, what usually happens is you're working and you are schooling. So they're paying you salary monthly, and they're paying your school fees as well. So after you're finished your nurse associate course or program, you can go on and top up and become a band 5. If you do not want to go through that route, you can sponsor yourself and go to school and study to become a nurse, if that's something you are interested in. And depending on your qualifications, if you have like a bachelor's, you can decide to do like a master's in nursing to be able to become a nurse. So there are different routes that you can consider. Oluchi said, I'm in recovery. What requirements to change to pain nurse and benefits of being a pain nurse? As a recovery nurse, you have a little bit of an advantage. The reason why I said you have a bit of an advantage is because, first off, you do a bit of pain management after the patient comes from the theatre. So you have a little bit of an advantage. What you do is you are acquainted to devices like patient-controlled analgesia. You have some other devices that they use like an ambient pump or a fuser, depending on what your trust uses. They help with pain management. So with that, it gives you a little bit of an edge because you're already in recovery. Something else you can do, Oluchi, is go online, do like some short courses. I wouldn't say start a master's in pain management. I would rather say get on the job first. And if pain management is something that you were interested in, then you can go on to do a master's in the course to give you an edge, and then you can proceed up the ladder that way. Because what I did was, because I was interested in the course, I went on to do like some online courses, and then I shadowed the pain nurse that was working in my trust. So that gives you an advantage, because when you are invited for interview, when you tell them all of these things, they know, oh, this person is really interested in this job role, and this person has done so and so and so and so, and then you can go on and start applying for jobs. So that's like the basic thing you need to start with first. There are no, say, any outright requirements that you have to do to say you need to have this and have that and have that. No. If you find yourself in a situation where experience wise you have an advantage, which you are a recovery nurse, that's one. Secondly, you can go on to like short courses. Some of them are free, some of them you would have to pay discounted amount for, not that expensive. It can be discounted, and some of them you'd have to pay a large amount for. So depending on the courses that you are interested in. I hope I answered your question, Oluchi. Oh, benefits of being a pain nurse. So one thing is the fact that you are in a specialty and you can specialize in that area. Another benefit is for people who do not like the shift pattern kind of work, you have like standard time that you go to the office for. So it's either you work 8 to 4 or you work 9 to 5, and you work Mondays to Fridays. So that's that one. Another thing is you've got your weekends off, so you have time with family, you've got time with friends, you have your evenings and your nights off. You've got time if you've got like kids that you would want to take care of and things like that. Another thing is, or something you need to know, is the money probably might not be something that you would like, because as someone who works in pain management, if you get the job as a band 6 nurse, there's going to be a drop in your pay. And that's because you are not working night shifts, weekend shifts, so you do not have all of the enhancements that you would have as a band 5. But there probably would be a drop in your pay. And you have the peace of mind. You will not have that whole people telling you, oh, your pain is at risk, your pain is... Yes, you have to be careful with the recommendations you give and the suggestions you provide, but then you have that peace of mind. You're not that stressed. You've got your time to yourself, and you would enjoy the job. So I think that's another reason why I went into the job role. Any other question? You're welcome. I hope I answered your question, Oluchi. If you want any clarity on anything I've said, just let me know. For some of the courses that you can do, is you just go on read.co.uk. Let me see. Go online and just type read.co.uk. You would see options there, because even via Read, you can apply for jobs via Read. website, but some of the courses you can do, just go on read.co.uk, and under the course area you can search pain management, and then you can start just peruse through it, see the one that you were interested in, and do the course that you think would give you an advantage. Emmanuel said, what should the CV reflect when applying for these roles? I mean, what are they looking for in applications? It depends, because different job roles and different job description. So usually what I tell people is ensure that you have a look properly on what the job description is and what the requirements are. So if you have a look, you will see like the person requirement, the desirable, and that list there. Have a look on it properly, so that by the time you are doing your personal statement, if you are applying via track jobs, you have to reflect those things that are in the job description, in the requirements that have been listed. You need to reflect them, because most times they'll tell you the person has to be a nurse, the person has to probably have an experience either on the surgical floor or in a theater or ICU, or the person needs to have like good communication. Depending on what the job requires, really ensure that you impute that in your personal statement if you're applying via track jobs, even on your CV if you're not applying via track jobs, because track jobs is really easy for most people to apply jobs through, because you already have like an online what's it called, an online CV. Yes, you already have an online CV, so that's something that you can look into. Also ensure that when you are imputing like your job roles, what you do underneath has all of those things, your education, the certifications that you have done, all of those things. Ensure that you impute them on there. Let it reflect what the job is asking about, because that way by the time they are selecting people that they would want to invite for interview, they look at all of those things. Sometimes it's more like an automatic process. They have like a process they go through where they just pick out, oh, this person said so and so and so, and the job is requiring so and so and so, and they pick you to attend interview. Then it goes on to you to defend yourself if you're invited for an interview. If you don't mind, could you do a live on nursing interview in general and pain nursing interviews? Okay, that's that's something I can consider doing down the line. Is there a band 5 pain nurse role? Yes, there is a band 5 pain nurse role, and if you want to start as a band 5 pain nurse, that's fine. That's absolutely fine. There is no reason to say you cannot start as a band 5 pain nurse role. There are band 5 pain nurse role, but usually as a band 5, and if you want to get into a specialty, I usually say go for the band 6, because that's like a push for you. You don't want to be a band 5 where you're earning somewhere between 1,800 and 2,000, and then you go on to become a band 5 and then you are earning less than that. And it's a build up for you career wise. You are improving in your career and you have more time for yourself. So yes, there is a band 5 pain nurse role, but I would say when you are applying, apply for the band 6. If you don't mind, that's fine. You can apply for the band 5 pain nurse role. There's nothing wrong with that. If you want to, you know, go up and beyond, then you can apply for the band 6 pain nurse role. What is the career progression like? Well, there is career progression. So I was a band 6 pain nurse when I started the job, and I'm currently a band 7 as a clinical nurse specialist in the job role. So usually what can happen is you can become a band 6 pain nurse. Some trust would say pain nurse practitioner, pain nurse sister as a band 6. Some would probably say deputy clinical nurse specialist, those kind of job titles, but as a band 6. As a band 7, you can then become like a clinical nurse specialist or like the team lead and things like that. It's either you go into that area where you are like the team lead and stuff of your team. Or something else you can consider doing is going into an advanced clinical nurse practice role, where you would be like, you can apply for a trainee position and you're training in to specialize in pain management. So what then happens is you would get the job as a band 7, but when you qualify you then become a band 8. Does that make sense? So that's like progression for you. So those are things that you can consider if it is something that you are interested in, and then you can work your way up depending on your interest. Oh, she said, how long did it take from band 6 to band 7? It differs with people. It took me 1 year. So I was a band 6 for 1 year before I became a band 7. I started, no, 1 year and some months. I tell a lie. One year and some months. Because as a band 6, I started my band 6 role November 2022 was when I started my band 6 role, and then I got my band 7 role November 2023. But then the whole documentation process and everything, I started my band 7 role February 2024. So yes, it depends on what it is that you are interested in, and it depends on how you want to progress in your career. So as a band 6, you can start working on some things that you would want to achieve. If you want to go up the ladder, you can decide to look at band 7 job roles, look at what it is that they require, and then you can start preparing yourself to get some of those things. Wow. Yeah. Yeah. It could be shorter for some people. There are some people who moved from being a band 6 to band 7 like within 6 months. There are some people that it took longer than that, but then different people and different interests. What it is that you desire is what it is that you'll work towards. So any other question? I don't think I have any other question I would want to respond to, because I think I've responded to all of the questions I can see on here. Well, yeah. If you work in the NHS, there is something else that you can consider. So you can go online, because there is like a pain module. You can go online and type e-learning for healthcare and register on this for NHS England. I don't know if people working in care homes can do that, but there is a pain module there that you can consider doing. It's really good stuff. So have a look on that and ensure that if pain nursing is something you want to consider, you can do that module and work your way from there. So if I want to move to pain nursing, I should be looking at the band 6 advert, right? Well, Ology, yes, because I'm assuming you're a band 5 at the moment. There are band 5 pain nursing roles. Yes, there are band 5 pain nursing roles. If you don't mind, you can apply for a band 5 pain nursing role and work your way up, because that way it gives you an advantage that they say, okay, you've got this experience as a band 5 pain nurse, and you can work your way from there. If you don't want to move from a band 5 to a band 5 pain nursing role, I usually say go for the band 6, because that's like an advantage for you career progression wise, and you are going into a specialty as well. So I would say go into a band 6 pain nursing role, look at the advert. But if you don't mind the band 5 pain nursing role, then yes, you can apply for that. There is nothing wrong applying for a band 5 pain nursing role, but I am assuming you would want to grow in your career and you would want to try something else. So if you don't mind the band 5, apply for the band 5. If you want to grow in your career, apply for the band 6. You probably would have to apply for a lot, and then you will get the one that will tell you congratulations by giving you the job. But if you don't mind all of the unfortunately you would get, then I would say go for the band 6. I wouldn't want you to go for a band 5, because as a band 5, like I said, when you progress to becoming a band 6 pain nurse, there's going to be a dip in your salary. When I say dip, a reduction in your salary, yes. And that's because you do not work shifts. So you don't do night shifts. You barely do weekends depending on the trust. And so you don't have all of that enhancements that you would have working as a band 5 when you are working on bank holidays and working on the weekends. You would not have all of those. So it would just be basic salary. So if you move from a band 5 working on the ward to a band 5 pain nurse, you will notice the very big dip. But if you move into band 6, you will notice the dip, but it will not be as much. So I probably would weigh my options and see which one is better for me. But if you would want to start the journey as a band 5, then that's fine. There's absolutely nothing wrong with that. Okay. Are there different roles as a pain nurse? What? Oh, is there a chance from remote working? I've really not seen any remote working role as a pain nurse. It depends on what the trust does. I've really not seen remote working role. But different roles as a pain nurse, not really. To the best of my knowledge, there are no different roles as a pain nurse. Okay, so when I was working as a band 6, the job itself encompasses different areas. So there was research in it. I was beginning to work a little bit of some chronic aspect of pain nursing. So my job role was as an acute pain nurse and a chronic pain nurse. So you can do the job as an acute pain nurse or as a chronic pain nurse, because where I'm working right now, my band 7 role is in chronic pain service. So I've got nothing with acute pain nursing. I do not work in the inpatient area. I really do not have anything with that. So if that's your question, yes, there are different roles, and that's you working as either as an acute pain nurse, where you work as an inpatient nurse, or as a chronic pain nurse, where you work in the clinic. And then there are some trusts or some organizations where they do a mixture of both. So as the inpatient pain nurse or the acute pain nurse, you do both the inpatient review and the chronic pain review. But most organizations, they separate them. They really do not do both of them together. So you as the pain nurse will not do both of them together. You would either be an acute pain nurse or an inpatient pain nurse or a chronic pain nurse. So if that's your question, Emmanuel, that's it. Yeah. You please put amounts to the pain nurse band 5 and band 6 salary. So as a band 5, I really didn't work as a pain nurse as a band 5, so I cannot tell you how much particularly it was, but it would be somewhere between 1,800 to 2,000. I would assume it would be somewhere around there. As a band 6, your salary is around 2,000. If you have a little bit of an extra, you probably would have maybe say £100 extra. It's not up to £200 extra. No, it's not up to it's not up to £200 extra. So you are earning between 2,000 and 2,100, or just a little bit sprinkle on top of the 100, just a little bit extra. So as a band 6, because you don't work nights, you don't do weekends, and you don't have all of those enhancements, so that's where the salary is around that area. Dennis said, how long does it take to study band 5 nursing in the UK as a beginner? So nursing here in this country is for 3 years. If you're doing bachelor's, it's for 3 years. If you decide to do the master's program of becoming a nurse in the UK, the master's is 2 years. So depending on the route you want to go through, if you decide to go to the university, sponsor yourself, go to the university and do nursing, that would take you 3 years. If you decide to go as a nurse associate and then top up to becoming a band 5 nurse, it would take you somewhere around there as well. And if you decide to go do masters because you have a bachelor's in another area, but then you want to study nursing and then you decide to do the masters, it's called masters pre-registration nursing. If you decide to do that, then it will take you about 2 years to study nursing in the UK. Yeah, I think that's it. I don't know if anybody has any other question. If not, I should let you all have a good day. Any other question before we bring this live to a close? Could you apply for such role from abroad? I probably would say yes. I probably would say yes. Chances that you would get it, depending on if they are giving certificate of sponsorship, they might not. It might be a little bit difficult, but nothing is impossible. I don't want to say it is impossible. I would want to say it is possible, because I don't want to make you not, I don't know, how do I put it? I don't want you to think that it is not possible. Yes, that's it. English is hard. I don't want you to think that it is not possible. It is possible, okay? But it depends on if the trust is giving certificate of sponsorship. That's one. Secondly, it depends on what their requirements are, because some of them would have to say that you should be in the country first because you would need to have that UK experience. But it is possible to get it as a band 5 from abroad. Yes, it is possible to get it from as a band 5 from abroad, because you probably will not be doing a lot of the leadership and the management aspect of it, and they would train you more on the job, and you can work your way up the ladder from there. And I would say yes. Yes, it's possible to apply for such a role from abroad if you are being given a certificate of sponsorship. So yes, it is very possible. Denny said thanks. You're welcome. I hope I'm able to answer your question correctly. Any other question? How much autonomy do how much autonomy do one have on the job? Well, in the band 6 role is more management, and it's more leadership position, so you have a lot of autonomy. In the band 5 role, your autonomy might not be as much as how it would be in the band 6 role. So take for example, when I was working as a band 6 pain nurse, I had more autonomy than when I was working as a band 5. I could make decisions on my own. And if I feel as if, okay, this decision I'm making, Kai, Mercy, do you think this decision is the right one? Do you want to double check with your pain consultant? Then I usually brainstorm with them, or even brainstorm with my other colleagues and say, okay, this is what I want to do. This is the patient, this is the diagnosis, this is the current treatment plan, and this is what my recommendation want to be. And if I feel as if, okay, I need to brainstorm, then we can brainstorm and come up with the plan together. So yes, there is a lot of autonomy working as a pain nurse, and as you grow up the ladder, your autonomy increases as well. Thanks for your responses. You're welcome. Denny said, I'm not a nurse, but I would love to study in the UK. Where do I start? I'm currently in Kenya, but currently coming to the UK as a caregiver. So when you come to the UK as a caregiver, and congratulations, let me say congratulations first for getting for getting the job as a caregiver and coming to the country. Congratulations. When you come into the country, if it were to be me, I would weigh my options, okay? Do I want to pay for my studies first? Or do I want my employer to pay for my studies? That's something you should consider. So if you would want to pay for your studies yourself, then that's fine. You can go on and apply and say, okay, I'm paying for it, get the admission and start studying. You can do that part-time. If you want your employer to pay for you, then you need to have a look and see what the employer is offering. Because like I said before, some of them would say you would have to start this journey of becoming a nurse in the UK as a nurse associate first. And if you do that, you move to a band 4. Because as a caregiver, you're currently a band 3. I would assume that's where they employed you as. You're currently a band 3. If they decide to sponsor you to do like the nurse associate role, then that's a band 4. And then you can decide to top up and become a band 5 if you don't mind. If you have a bachelor's in another area, then you can do an MSc pre-registration nursing and become a nurse in the UK. But like I said, there are different options. Weigh your options. Are you employed by the NHS? Are you employed in a care home? Would your employer be willing to send you to school? Because usually if they pay your tuition, they pay your school fees to school in this country, then you would have a contract with them and say, okay, you're paying my tuition and I have to work for you for maybe 2 years or 3 years or certain number of years, depending on what it is that the contract says. Depending on that, then you can do that and start your journey. So if I would advise you, Dennis, on how you could become a nurse in the UK, you need to see where you are at the moment. Do you have a bachelor's? Do you want to do an MSc in pain nursing? Do you want your employer to sponsor you in becoming a nurse, or do you want to pay for your tuition yourself? So those are your options, and then have a look and see what your trust is offering. Have a word with your manager, because sometimes there is that gap, there is that availability in your organization that they need somebody to fill, and they will be willing to sponsor you. So have a word with your manager and see what is available in the trust or in your care home or whatever it is, because there is room for professional development and you are entitled to certain amounts in a year. So if you have a look into all of that, you can decide on which route is best for you. Okay. Okay. What is your advice for someone who is already 40 years old? Do you think that the person can still study nursing at that age and also have a family? Yes, of course, definitely. It depends on where you are at the moment. So if you are in Nigeria or currently in the UK, or what your circumstances are, in Nigeria there is School of Nursing. School of Nursing is 3 years. If you decide to go to the university, it is 5 years. I went to the university and I did 5 years in school, and I was able to get a bachelor's. But School of Nursing is 3 years. You can do that and start your journey as a nurse, and then you can migrate to whichever country you want to go to. So depending on what your circumstances are, as someone who is 40 years and you have a family, you can juggle it. As long as you have a supportive partner and you have a family who would be there to help and support you, yes, of course, definitely you can. I've seen people who are even older than 40 years old and they're still going back to school to study nursing because it's something that they are passionate about and it's something that they are interested in. So yes, you can absolutely go back to school to study nursing. Then he said, thanks again. I don't have any bachelor's. Okay, so then your option of studying nursing as a master's is out of the way because you do not have a bachelor's. The two options available to you at the moment is paying to study nursing yourself or going through your employer. So those are your two options at the moment. You need to weigh them and see which one is going to pay you more and which one is going to be easier for you to achieve. Mr. Moses said, what is your advice for someone who is already 40 years old? Do you think that the person can still study nursing at the age and also have a family? Yes, I've just responded to that. Yes, you can. Definitely, absolutely, you can. I would need you to assess your current circumstances. Assess, is this the best decision for you to do? Because it is a job that gives it, or it is a profession that gives satisfaction. So if it is something that you would want to go into, then you would know that, okay, for the next couple of years, this is what it is that you would want to do. There are people who study nursing and they're still working and still supporting your family. So absolutely, yes, if you're 40 years old and you've got a family, as long as your family is supportive, you can absolutely go into the profession and you would do great. So yes, please start the journey. If you are interested in it, please do start the journey, and I hope it goes smoothly for you. And I want to hear the story down the line. If you want me to give you my own virtual support, please let me know. I'm more than happy to do that. Okay, I think we've gone long and long. Any other question? If anybody has any other question, I would take the next couple of minutes to answer. If not, I think we probably will end this live here today. And you guys have been amazing. Thank you. Thank you so much for all of the questions that you have asked. It has been a wonderful time. It's my first live. Will I want to do it again? Yes, I would want to do it again because someone had asked a question on, let me have a look so I can note it down and see. Yes, please, if you don't mind, could you do a live on nursing interview in general and pain nursing interviews? Okay, I would be doing a live again to answer this question, and I hope that I would see all of you again. Hopefully to answer such questions, because a lot of people have been applying for jobs and they would want to have like tips, they would want to have more information about it. So I would be doing a live on that. Something I forgot to mention is, if you are considering being a pain nurse, or as a summary, if you're considering the journey of a pain nurse, what you need to do is you need to assess your current situation. Is this a specialty you would want to go into? That's one. Secondly, what experience do you have? For people who do extra shifts, and you're not working on the surgical floor at the moment, so you do not have exposure to things like patient controlled analgesia or any other form of pain management. If you do not have an experience in that, something you can do is do an extra shift in such wards or such areas where you know that you would have an exposure to PCAs, as patient controlled analgesia, or to an ambient pump, or to a fuser. Those kind of exposure, those kind of experiences, do an extra shift in those wards so that you know what it is that these devices are all about and what kind of care it requires working on such wards. So that's something you need to do. Then you can decide to volunteer yourself to be something called a pain link nurse. So there are a lot of trusts who do pain link nurses roles or something like that. So you can speak to your line manager to say, okay, you want to be the pain link nurse of your ward, and that means that anything that involves pain management, you're the go-to person. Okay, so if you have that added to what it is that you do, you will be a bit more exposed to pain nursing, and that's an advantage for you. Thirdly, shadow the pain nurse in your organization, in your trust. Shadow the pain nurse there, so you know what the day-to-day activity is. in your trust and what it is that a pain nurse does on a day-to-day basis, shadow them. Then you can go on to do some online courses. Okay, do like some short online courses. I would not advise to do a master's at this stage because you probably might not be that interested in the pain nursing role. So do some short online courses. Some of them are free, some of them you would have to pay certain amount of money for, but then do some short online courses and go on and start applying for jobs, because you would not have to wait forever to say, okay, you need to do this and do this and do that and do that before you start applying for jobs. No, go on and start applying for jobs. Ensure that your personal statement and the job description are all in sync, and it is something that you would place yourself in an advantageous position if you have all of these things listed on your CV, that you have done this course and you have done that course and you have all of these experiences. It gives you an edge so that by the time they're inviting people for interview, they would invite you as well. Fingers crossed on that. And I want to say congratulations. Congratulations. I would love to know how it goes down the line. If you decide to start this journey as a pain nurse, or if you decide to do something else, please do let me know so that I can congratulate you on starting the journey. And I think that's the end for today. Thank you all very much for joining this live. It has been good. It has been good, really good. And oh, there's one more question here. What about if you came to the UK illegally, you don't have papers yet? Can you study nursing? Ooh, that's a very tricky one. I don't think it is possible. To the best of my knowledge, you probably would have to go back to your country to apply for a student visa. I could be wrong, but to the best of my knowledge, I don't think that's possible, because you would need to be on the appropriate visa to be able to study in the country. So if you come illegally and you do not have the papers yet, you would need to have the right visa category, because you would need to apply for a student's visa to be able to study that if you are not here on a work visa already. Because as a worker, you have the right to study in the country. So if you do not have any legal documents at the moment, you will need to have the right legal documents to be able to study nursing in the country. Okay. Well, thank you very much for joining today's live, and I will see you in the next one. Bye guys. Thank you all very much. Have a good day.